So if you're dealing with H. pylori or SIBO, in this video we're going to go over some studies that'll help you understand how an Where did the dog go? That'll help you understand how an H. pylori infection can lead to SIBO, or small intestinal bacterial overgrowth. Like, all the cool kids have SIBO now. And it's okay if I'm standing in front of these studies. We'll make them big when we talk about them, and I'm going to put links to all of these studies in the description below if you want to dig into this a little bit more. But when we're talking about this, we need to understand that SIBO has the ability to create a hypochlorhydria issue, or low stomach acid. And this can be a real problem because the stomach acid is not just there to help us acidify the food so that we can break it down and actually get the nutrients out of that food. It's also the barrier to the whole digestive tract. When these varmints come in on the food that we're eating, they're supposed to die in an acid bath. So when that stomach acid isn't there, we're leaving the front door open and letting all these bad guys in. So let's look at this study here on H. pylori infection and small intestinal bacterial overgrowth, more than meets the eye. And they say studies have suggested an association of SIBO with altered anatomy, hypochlorhydria, dysmotility, immune deficiencies, small intestinal disease, and PPI use. The correlation between PPI and SIBO has been well established. One meta-analysis with over 7,000 subjects found a 3-fold increased risk of SIBO in patients who had received PPI therapy. And of course, with an H. pylori infection, the most common treatment is what they call a triple therapy, where they use a couple different antibiotics and they use this PPI, or a proton pump inhibitor, that turns off the body's ability to make stomach acid. And they do this because a lot of times with H. pylori, there'll be a lot of inflammation or gastritis or even ulcers in that stomach lining, and turning off the acid gives that time to heal. And while they're using these antibiotics, some of these antibiotics work better in a more alkaline environment. So that seems to be the thinking behind that process. But even if a person didn't use a PPI, this study here says that during active H. pylori infection, gram-negative bacteria hydrolyze urea into ammonia and carbonic acid in the stomach. The ammonia byproduct buffers gastric acid, leading to an increase in stomach pH to protect the organism and allow further proliferation. Over time, atrophy of the gastric mucosa occurs, permitting multiplication of the bacteria. The preferred treatment of H. pylori infection includes a course of proton pump inhibitor therapy, which further raises gastric pH, and antibiotic agents, and may also cause dyspepsia and consequent gastrointestinal symptoms. Both mucosal atrophy and gastric pH alterations have been proposed to predispose patients to SIBO, or to some type of infection here in the small intestine. So they mentioned it's well established that antibiotics can lead to dysbiosis, and this is because an antibiotic is made to wipe out some type of bacterial infection. So it wipes out all of our good gut flora in this large intestine as well, and then they're not there to police the situation if bad guys come in, and then they just kind of turn it into a bad neighborhood. So what's important to understand is that H. pylori has the ability to buffer these acids in the stomach and then raise the pH, make that a more alkaline environment so they can really thrive. And a lot of people will tell you, oh no, H. pylori thrive in an acidic environment. But the reality is they can survive in an acidic environment, but in order to really replicate and colonize, they need it to be a little bit more alkaline. Not too alkaline. They don't thrive down here in the small intestine. That's a little bit too alkaline for them. But they can't have it be a normal acidic stomach level for them to really mobilize and to colonize. So when they can alkalize this stomach, now they can really thrive. They can have a big party. They're going to invite all their friends because the front door is open. And so now all these varmints are coming, and everybody's coming. Even that tool bag from your shop class, everybody's showing up at this party. And a lot of these varmints like to colonize down the small intestine, so they come down here and we end up with this SIBO issue. So let's look further into this study where they talk about the pH of the stomach should be about 1 or 2. That's very acidic. And using a PPI can raise that pH to 2 to 3 in a healthy person, but during an H. pylori infection, where this infection might already be alkalizing the situation a little bit, using a PPI has the ability to raise that pH up to that 5 or 6 range. And it says within the pH range of 5 to 6, enteric bacterial load can increase by as much as 1,000-fold. Well, 1,000-fold is a whole lot. That's a really big increase. So you can see leaving the front door open can create a lot of trouble. And we mentioned before about this correlation between SIBO and dysmotility, and a lot of people will say, oh, if you have SIBO, it's because you have a motility issue. This MMC, or migrating motor complex, is not coming through and clearing all these things out and clearing the bacteria out. So it's just a motility problem. The reality is this MMC function is triggered by stomach acid. Stomach acid triggers all these hormones, and it's these hormones that are telling this action to happen. So when that's not happening, it's usually because there is a lack of stomach acid. Now, to understand a real big problem when it comes to SIBO, to hold my beer and watch this. This is going to freak you out a little bit. We need to understand with this study here, H. pylori infection, hypergastremia, and peptic ulcers. So gastrin is a hormone that when food comes into the stomach, and that stomach becomes more alkaline from that food, that triggers gastrin to be produced. And gastrin tells the stomach, hey, it's time to make some stomach acid so we can acidify this food correctly. So when there's a problem that's restricting that stomach from becoming acidic, then the body's like, oh, well, I'll just make more gastrin. That's the thing that I do to tell the body to make stomach acid, so I'm just going to make more gastrin. Now, that makes an elevated gastrin issue. This study here shows us that when somebody has H. pylori, they often see elevated gastrin levels. Well, here's the real problem. Gastrin has another job. It goes through the circulatory system, and it comes down here, and it tells this ileocecal valve, which is a valve at the end of the small intestine that connects to the large intestine. It tells that to open up and start moving food into the large intestine, because it's basically signaling, hey, more food's coming in, so let's get this stuff moving to make room. But when that gastrin is elevated all the time, because there's no stomach acid being produced and there's food in there, now that's triggering this to be open all the time. Now these bad guys are coming back down into the small intestine where they shouldn't be. So if we have some type of dysbiosis issue where this is not a good neighborhood, and now the back door is open too. So we have the front door open and the back door open. How could this person not have SIBO? Well, we left the front and the back doors open in our cabin in the forest, and we smeared honey all over the kitchen, but we didn't think bears were going to come in while we were sleeping. Why would they not come in? We need to shut the doors. It makes sense while this SIBO is occurring. So this is in the medical literature. Like, I didn't get this from a My Little Pony coloring book. We know this is happening. So like, dear medical world, let's be smarter than this. We know what's happening. Why do we allow this to happen? So we want to close the back door. And let's look at this. Let's look at this study on influence of H. pylori infection and eradication on SIBO issues. So in this study, they found that if someone had H. pylori and they fixed that problem, that it also fixed their SIBO problem. So if you had the ability to start acidifying the stomach again, once that H. pylori was wiped out, then you would be closing the front door. Then this back door would also close because the elevated gastrin levels would come down. That study found that when they removed that H. pylori, that the gastrin levels came down. So if they're closing both of those doors, they're wiping out the bad guys that come in, they're signaling hormones to tell this MMC to clean out the small intestine, it makes sense that the SIBO issue would be cleared up as well. Now, for a lot of people, eradication of that H. pylori is not going to be enough because they may not be able to start making HCl on their own again. A lot of times, this H. pylori can damage the peroneal cells that make that hydrochloric acid. Some people are in a stressed state, and when the body's in this stressed fight or flight state, it can't really make HCl the way that it's supposed to. Some people don't have enough resources to produce the HCl. There's a lot of reasons that someone may not be able to make enough stomach acid, so just know that for everybody, just wiping out H. pylori is not going to be enough to fix their SIBO issue. They're also going to have to take steps to reduce that as well. So when we're looking at these treatments, I don't want you to listen to all these things in these studies about the PPI use and these antibiotics and think that I'm telling you not to do that. If your doctor is telling you to do these, don't listen to me. Remember, I'm not a doctor. I'm not giving you medical advice. I'm basically a professional stand-up comic turned nutrition author, because when I lost my voice for 8 years and 23 different doctors couldn't figure that out. I had to dig for my own answers a lot. And now, 20 years later, I've been teaching health professionals in more than 40 countries how to help their clients fix the actual underlying causes of problems instead of just covering up the symptoms. So don't take anything that I'm saying as stop doing what your doctor's taking, but remember, these links to these studies are in the description below. You can go through these and that'll help you figure out the right questions to ask your doctor. So these can be confusing topics. If you need to learn more about wiping out a SIBO issue, you can jump over now and check out our video on breaking the SIBO cycle. And if you want other options for treating H. pylori, maybe you don't want to go the standard route, you can check out our video on science-backed steps to fix an H. pylori infection. I can't wait to hear about your results.